One of the most common things that we see and treat are people who either want to avoid surgery or have already had it. They've been let down by the medical system. They've had injections and medications and they don't want more, or they recognize I've had them before, I don't want them this time. But one of the things that really it makes me sad and I get really frustrated is when I hear about people who were offered surgery before ever being offered conservative care. To me, conservative care is education, hands-on, exercise, etc. Conservative care is not injections, which, they inject fluid into your body. It has side effects, infection, like degradation of the cartilage and joint structures, etc. You get medications, which if you go and listen to any commercials about medications, you'll hear there's a laundry list of side effects. One of the problems is in the medical community, conservative care is injections and medications. In my world, conservative care is modifying your exercise, doing a different exercise, massage, yoga, Reiki, hey, let's even get you acupuncture and chiropractic. I mean, we're not, the side effects of these things aren't like tragic. The side effects of medications and surgery are, like the possibilities and potential is tragic. And so one of the things that people aren't really telling you, or what they are telling you, and this is what I hear from my patients is, oh, it's just a routine surgery. We'll have you done in and out, and it's routine. Well, you know what? It's routine for the surgeon doing the surgery. It's routine for the medical provider who's doing it all day long. It's not routine for you. The surgery is not routine for you. And if you're ever being given an option of surgery without given the option to do something first, like modifying your behavior, I'm talking about orthopedic surgery. I'm not talking about okay, you've got a brain tumor surgery. You need an angioplasty because you've had a heart attack. You've got a tumor or, spinal cord compression. I'm talking about surgery for back pain, shoulder pain, neck pain, jaw pain, foot pain, wrist pain, pain. If you have pain is not an indicator for surgery. And if you're being offered surgery because your main symptom is pain and you can't move something very well, and they don't offer you anything else like physical therapy or even massage or chiropractic or acupuncture, they're not offering you conservative care, then run away or go get another opinion. And maybe don't even get another opinion from someone in the same practice, or the same kind of provider you're seeing. Find someone else, because there's multiple ways to get this done, and so many people are being offered surgery without being offered physical therapy first. And I'm going to define physical therapy for you. Physical therapy is not rehab after surgery, which is the way a lot of medical providers here in our community treat it, or at least that's my perception from what I'm hearing. People come to our clinic and with their problems. What we do is we help active people stay fit, healthy, and mobile. And we do it with our hands. We do it with our conversations, by having a conversation with you, with our patients, and we do it by analyzing movement and figuring out what is really wrong. And if we do think surgery is indicated, then we'll send you to the right person. But the next person for us isn't even the surgeon. The next person for us is the sports medicine medical provider who's not a surgeon, who then says, oh, this is a medical problem that we can resolve with diagnostic ultrasound and a diagnostic ultrasound guided injection. Okay, the person doesn't need surgery. They don't have a vested interest in giving them surgery. So they need to move on to the surgeon. And that's how we see it. That's how I see it. For instance, I think there have been 3 or 4 people this summer who I've seen who are going to get either knee surgery, shoulder surgery, or back surgery, who were never given the option to get physical therapy first, and their surgeon or clinic where they were seen that offered them surgery, they have physical therapy there, but they treat it like a post-surgical rehab. And what I'm saying to you is that if someone doesn't offer you physical therapy first for an orthopedic problem, an injury, pain, and then you need to see what's possible, because a rotator cuff tear, a bulging disc, a slip disc, a herniated disc, a meniscus tear, a hip labral tear, all these things, you know, I can't fix them with my hands. But what I can do is I can help you get back to the activities that are important to you without pain and without making things worse. And we do that all the time, and I see it all the time, and it just frustrates me a little bit. And you might hear this in my voice, because it's just frustrating me, because what the medical community is not telling people is that surgeries really should be like end of the line, last option, because things like back surgery for low back, non-specific low back pain only work 50% of the time. My mission is to help save 100 million people from unnecessary surgery and even unnecessary imaging. And I can't do it alone. What I can do is help you understand some of your options. And that's what drives me every day, is to figure out how can I reach that next person. So if that's you, or if that's one of your friends, or someone you know, or someone you love, please share this video with them, or share the video to your community, or tag them below. Somehow get them this message that surgery is not routine for you, the patient, and it's not always necessary right away, and it shouldn't be on the table right away unless you're if you're having an orthopedic injury or orthopedic condition, a back pain, a knee pain, something like that. If you've got there's like neurological issues, cancer, like tumors and other medical problems that we easily recognize as non-physiological pain. It was like non-musculoskeletal pain. I can easily recognize that. And then, yes, surgery is great, it's good, it helps save people's lives. And surgery for back pain, it doesn't work very well, and you can die from it. And I've had someone in the past who complimented me on my work with my patients, and never came to see me as a patient, but then a few years later I had heard that they had passed away on an operating table for a back surgery. I don't know what back surgery it was, but it breaks my heart thinking that, okay, you've got back pain, like why can't we, there's a disconnect. And so don't call me a physical therapist. We're back pain experts. We are movement experts. I can help you maintain the active, healthy life without pain meds, injections, and surgery, because there is a solution. There are other options. It's kind of like drinking diet soda or drinking water. We all know that sugar soda is bad for our health, but diet soda is also bad for our health. They've done studies that show that diet soda is bad for health, but not everyone recognizes that yet. But water is the sustaining life. Water is what we need. Really, it's what we need is water. So let's drink more water. Water is the healthy thing. There's side effects to water if it's contaminated. But if you get purified water, it's going to be exactly what you need without all the added, sugars and chemicals and stuff that are either in the sugar sodas or the diet sodas. Hope that makes sense. So, if I'm thirsty and I'm stuck on an island and there's bottled water and soda, I'm going to drink the bottled water first. Because so let's do this. So this is what I want you to do, is just understand that when you get a medical opinion about something, it's not your identity. So you're not your MRI. You don't always need surgery to solve the problem. Sometimes you will, but most of the times there's another solution. And so if you are someone who's interested in finding out and figuring out what are my other options, I encourage you to speak to other medical providers about this in your community. Seek out other providers like physical therapists. If you're local to Greensboro, give us a call. We would be happy to talk to you about what's going on and give you a second opinion and work with your other medical providers. We do that all the time. And what I hope to do is spread the message that there's no easy fix to some of these pain issues, but if you're committed to doing the work, in just a few short weeks, we can help you change your life and get back to the activities that you really want to be doing. Thanks a lot. This is Dr. Aaron LeBauer with LeBauer Physical Therapy, and I hope you guys have a great day.